Hi, so today we'll be talking about the Apley Back Scratch test. This test is really great because it helps to show the range of motion and flexibility of the upper body, focusing on specific muscles that play a critical role in shoulder movement. These muscles include the rotator cuff group, which stabilize and move the shoulder joint. That includes the supraspinatus, responsible for shoulder abduction, infraspinatus and teres minor, responsible for external rotation, subscapularis, key for internal rotation, the shoulder capsule, which ensures smooth joint movement, Latissimus dorsi, the triceps brachii, and the pectoralis major and minor, which contribute to internal rotation and flexion. These muscles and this test will help to assess tightness, muscle imbalances, and restrictions in mobility. So to begin the test, the client or athlete should start in anatomical position with the feet shoulder width apart, and the pelvis should remain neutral, no tilting forward or backward, maintaining the natural curvature of the thoracic spine and keeping the cervical spine neutral. Then they should retract the scapula. This will help to prevent compensations during the test. Now, to perform the test itself, there are two main movements. The top arm will aid in external rotation, raising one arm straight up next to your head, bending the elbow to 90 degrees and reaching down towards the upper back. This position highlights external rotation of the shoulder joint with contributions from the infraspinatus, teres minor, and supraspinatus. Now for the bottom arm, it should have internal rotation, and the athlete or client should take the opposite arm and bring it behind the back, bending the elbow internally, rotating the shoulder as you reach upwards towards the top hand. This movement emphasizes the subscapularis, pectoralis major, and latissimus dorsi. The goal is for the fingertips or fists to meet. If they don't, we measure the gap between them. So now for measurement, here's how we measure the result. Using fist-to-fist contact is the most stable method for assessing range of motion, as it standardizes the starting points for the test. You can also measure finger-to-finger contact if the fists don't meet, but it may vary depending on finger length. The measurement reflects a combined range of motion in external rotation from the top arm and internal rotation from the bottom arm. It gives a clear picture of flexibility restrictions and muscle imbalances that might limit performance and increase risk. So this test matters because it helps to show the areas that a person needs to work on. For example, how they can increase their functional mobility, reduce injury risk, and help optimize their athletic performance when lifting weights, playing sports, or just going through daily life. To analyze the results, for the left side reach for external rotation and internal rotation, it was negative 27 centimeters, while for the right side it was negative 23 centimeters. Both of these measures indicate that it needs work, are classified as needs work, and some observations seen were wing scapulas and tightness in the posterior chain. Corrective exercises that can help are the cat-cow stretch with shoulder reaches, where you perform a cat-cow stretch and during the cow phase, reaching one arm overhead and across the body. This helps to improve spinal mobility and stretches the latissimus dorsi. Wall angels with resistance bands. These exercise, you stand with your back against the wall, keeping a resistance band taut between hands, raising the arms overhead slowly, mimicking a snow angel. And it helps to promote external rotation and stretches tight chest muscles. This targets the pectorals and the rotator cuff. The child's pose with the lat stretch is another exercise. It targets the latissimus dorsi and the triceps. You assume a child's pose and walk your hands to one side, holding the stress. And the doorway stretch, chest stretch, it targets the pectoralis major, pectoralis minor, the anterior deltoid. And it helps to open the chest to help with limited shoulder extension, and it counters the internal rotation and shoulder impingement. The T-spine rotation is another exercise that could be worked on, and it helps to increase thoracic spine mobility, which is essential for shoulder rotation and scapular mobility during overhead movements.